All right. Welcome, everyone, to today's webinar titled Normalizing the Sharing of Positive Youth Norms, Activating a Community-Level Approach. I'm Laura Papard, Director of ADAPT, which serves as the Training and Technical Assistance Division for Substance Use Prevention for the National High Intensity Drug Trafficking Area, also called the HIDTA program. ADAPT is housed within the Washington-Baltimore HIDTA and Center for Public Safety Innovation at the University of Baltimore. Before we get started, I'd like to go over a few items to orient you to how you can engage in today's webinar. We have over 900 registrants for this webinar. So while your video, sound, and chat have been disabled, we hope you will engage with presenters through questions, thoughts, and reactions using the Q&A feature on your screen. That's down at the bottom. ADAPT team members will be using the chat feature to send you information relevant to the webinar and help with any technical issues you may experience during the webinar. So please reach out to them there. Again, that was the chat issue to access ADAPT team members. Today's session is being recorded and will be made available on the ADAPT YouTube channel, which we'll send you a link to in our follow-up email when the webinar concludes today. Once the webinar ends, please complete the evaluation. It's going to pop up for you on your screen and provide us feedback. You will do this as well to receive the 1.5 free continuing education credits being offered. I wanted to give you a little context and set the stage for today's webinar. About 4 years ago, ADAPT received its very first technical assistance request related to prevention messaging and communications. Since that time, we've completed almost 100 requests on this topic. It is a hot topic. We've been looking at the science and working with experts in the field to better understand the best available evidence and the multitude of nuances that come with this evidence and using it for greatest effect. In service of the request, we have developed a substance use prevention communications toolkit, a social norms media campaign guide, and a variety of knowledge products on this topic. But today, we're going to bring you a different kind of conversation. You see, social norms as a concept, and specifically positive youth norms, has really resonated with all of you, our audience. And we have prepared many of you through workshops, learning communities, various toolkits, and individual technical assistance to implement and evaluate structured social norm media campaign interventions. Beyond those structured interventions, many of you wanted to share messages about the positive things youth are doing in your own individual ways and settings. And this is wonderful because we know that more frequent exposure of youth and adults in different contexts to messages that reflect the positive choices and decisions that youth are making increases believability of these messages, which then increases the impact on misperceptions and then on behaviors related to substance use. So we asked ourselves a hard question. How can a social norms approach be activated in the broader community youth are experiencing? And today, we're excited to bring this big picture to life for you by discussing how you as individuals and organizations can play direct or supportive roles in igniting a social norms approach in your communities. First, I'd like to introduce you to our special facilitators of today's discussion. Dr. Patty Fersizidis is our Associate Director for ADAPT, and in this role, she manages training and technical assistance product development and quality improvement initiatives. Considering that prevention communications has been a hot topic and primary technical assistance request over the last 4 years, Patty has graciously agreed to oversee development of a prevention communications department for ADAPT. So we hope to continue working with partners such as Dr. Perkins to continue building out our training and technical assistance services in this area. Dr. Wesley Perkins is Professor Emeritus of Sociology at Hobart and William Smith Colleges and founder of the theory underlying the social norms approach. This approach is geared towards preventing risk behavior. He has published extensively on this topic and consulted with hundreds of secondary schools, institutions of higher education, and community health agencies about social norms interventions throughout the United States and internationally. Welcome, Patty and Wes. Patty, I'll turn it over to you.
Thank you, Laura. Thank you for that warm introduction. Welcome, everyone. I am so grateful to be here with you all today. Laura set the stage for why we are here and what we're aiming to achieve by talking about activating the community for a social norms approach. But we just want to first get started by ensuring that everyone here is clear on what we mean by social norms. So for those newer to social norms theory tells us that people, all of us, but especially young people, are heavily influenced by what we believe others are thinking and others are doing. Where this becomes problematic in youth substance use is that there tends to be a tendency for youth to overestimate how many of their peers are actually engaging in substance use. Well, that itself means that that misperception is a risk factor, which can increase the likelihood that youth will engage in substance use. So the theory posits that the antidote is correcting that misperception. If we can elevate the truth that most youth hold positive attitudes around substance use, are not engaging in substance use, and share those widely, those repeated exposures to that positive, accurate data point can correct those misperceptions and ultimately change behavior. So we're kind of going off of the premise that many of you have already been exposed to social norms theory, but we do want to make sure that for those who might be a little bit newer to the approach, that we give you just a little bit of a foundation, an overview of what the social norms approach looks like in the context of preventing substance use. So to do that, I'd like to now invite Wes, founder of the theory of underlying, or founder of the theory that underlies social norms approach for preventing substance use, to the stage to share a little bit about this. Wes?
Thank you, Patty. It's great to be here today. And I'd like to say I'm particularly excited about the fact that so many people registering for this uh, new type of webinar talking about how we can move social norms practice and prevention to a higher level by activating a variety of community assets. It's a great thing to be doing, and I'm glad and happy to be a part of it. So my job right here at the beginning, as I understand it, is to give you a quick overview of what the traditional theory is, what's the framework, and so forth. Some of which Patty has already begun in her remarks of introduction. Let me get started with that. I'm basically going to be running through a series of there we go, slides about the social norms approach. And the social norms approach begins with the long tradition of theory and research on peer influence and conformity to peer norms. That goes back 100 years in social psychology. It's not something I invented. Much research in the field of the social sciences has consistently argued and demonstrated that peers have a lot to do with what young people, teens, and young adults do, and especially with regard to risk behaviors and substance use. So where does the social norms approach actually cut in? Well, social norms theory asks, what about the perception of peer norms? And that's what's different. We can talk about how peers influence us, but if we simply think they influence us directly, we may be missing a critical element here. So, what we're talking about is that youth and adults in all contexts and subpopulations misperceive many of the norms that surround substance use. And when we talk about norms, to be clear, what we're talking about is what is it that the majority of a population or a group of people, what is it that the majority do And what is it that they think is the right thing to do? What are their attitudes? What is the dominant attitude that's often called an injunctive norm? And what is the majority behavior? What is most common in behavior called sometimes called a descriptive norm? Those are what we're talking about, and they often are misperceived. In fact, what we know, what we think are the most common attitudes and behaviors of peers may not be accurate. In fact, regarding perceptions of alcohol consumption, for example, and I'm just taking one example here, most adolescents and adults overestimate the permissiveness of their peers, how often peers drink, how much peers drink, how frequently peers incur consequences, and all of that list of misperceptions are important to consider. If we think about this with regard to personal health behavior, whether we're talking about alcohol and the potential for misuse or other substance use or other risk behaviors, we often, if we do think about peer norms, are thinking about the actual norms. What is it that my friends are doing? Watch out for the kids in your neighborhood. What are they like? What's going on in your school? Is there a lot of drug use in your particular school? That those kinds of questions, thinking that what's actually going on has an influence on our personal behavior. And indeed it does. If we find a school or a community or a neighborhood where substance misuse is more heavily represented, the individuals in that area are more likely to be at risk. There's no question of that. But what that misses is what I call the elephant in the living room, the perception of peer norms. That is, what we think is the norm is a critical element here that we have to consider. And there's only a vague connection, hence a dotted line there, between what is the actual peer norms are in one's youth population, for example, in one's school, for example. There's only a vague connection between what is going on in terms of what the majority are doing in one's school and what I think I, as a youth in that school, would think is the norm. And so there's a misperception or a disconnect. And yet, what we find is the perception of peer norms has a dramatic impact on personal behavior. In fact, we've done research, several research studies demonstrating that the connection between actual peer norms, though important, is not as important as what I think that my peers are doing. What is perceived as real is real in its consequences. It is a sociological dictum. And so we have to take these misperceptions into account in how they play out in youth risk behaviors. There's two indisputable findings. The first is that the peer norm is one of the strongest predictors of personal behavior. And the second is that peer norms about substance use and other risk behaviors are grossly misperceived in the direction of overestimated risk behavior and permissiveness in attitudes. So extensive research shows that these misperceptions exist in all types of schools. We now know this work started off on my own campus in studying alcohol problems of alcohol use among college students. It's a big problem nationally among college students. But as we found, it's not the majority that are the problem. It's a significant minority of students that are the problem. And we began to develop this theory and intervention mechanisms to address it. But in the course of time, we found that this is true in all countries and all size schools. It's true in a variety of programs and actual norms and age levels. We started off studying college students, but began to move it outward into other populations like young adults in military units and statewide populations of young adults. And then we began to move it downward in age into high schools and finding this and also finding it in middle schools. We know that it's also there in subpopulations of youth. It's there for males and females, various racial and ethnic groups. They misperceive their own group and they misperceive the larger population that they're within. It's there whether we talk about the dominant attitudes or what is the dominant norm regarding use or protective behaviors are misperceived and so forth. There, protective behaviors are underestimated, risk behaviors are overestimated. It's there for all types of drugs, not just alcohol, but every drug that we've studied and looked at across the board in a variety of populations. And so, why this is so important is that, well, first of all, there are a variety of things that cause these misperceptions. I'm always asked about that. What causes them? Well, first of all, the brain plays tricks on us. We tend to think if we observe something in another person on an occasion that that's what they're like all the time because we don't have enough information about what they're like in other circumstances. And we tend to exaggerate or overestimate deviant behavior that occurs occasionally. Secondly, memory and conversation patterns play a role because we remember vivid behaviors, and that's what we talk about a lot. We talk about all the sensationalized uh, episodes where somebody's intoxicated or where someone is using drugs. We don't see all the myriad of ways in which people are not in those conditions. And then finally, the culture plays its role in amping the misperceptions. The entertainment industry and what it gives us for entertainment emphasizes the risk behaviors. So does advertising. So does the news. If it bleeds, it leads, is the expression in news. And then even health advocacy groups inadvertently can exacerbate the misperceptions as they talk about the problem. Understandably, they want to get concerned, they want to get parents involved, they want to get funding for this. But as they talk about this, the youth populations themselves hear groups and advocacy groups talking about all the time the problem among youth, and it becomes perceived as the majority. Well, there are consequences of these misperceptions. It's what I've called a reign of error. It's not a reign of terror, but a reign of error that controls us in as we act in accordance with those misperceptions. And what happens is that the actual use and abuse increases in the constraints of what we perceive to be the norms of excessive use and permissive attitudes. And layers of misperceptions compound as we participate in the conversations in exaggerated ways, and we fool each other about our behaviors and lead to further misperceptions. Opposition is discouraged from speaking out because they don't think anybody else opposes the risk behaviors, and interventions by others decline, and people become passive bystanders when people are engaging in risk behaviors that should be called out or should be some kind of intervention initiated. And then finally, most of the population are what I call carriers of the misperception and contribute to the problem because even if they'll never engage in the risk behavior themselves, maybe because of their religious beliefs or their parents' rules or the jobs they have to show up for or whatever it is, if they contribute to the misperceptions by saying, I don't do this, but yeah, most others do, they're contributing, and it's an contagious disease, if you will, that is spread through the population by that conversation. So translating the social norms into prevention strategy is letting people know that most of their peers make healthy choices, and that helps even more peers make responsible decisions. What we see, the model is identifying the actual norms and the misperceived norms in contrast. The intervention is providing intensive exposure to actual norm messages based on credible data collected from the population. And then that leads to less exaggerated misperceptions of the norms if done well and intensively, and ultimately less harmful or risky behavior. It's not rocket science. It's a very kind of simple linear phenomena if the intervention, if done well, but it's a paradigm shift from what often is done, where we spend most of our time trying to scare young people, youth and young adults away from the risk behavior, telling them, warning them, or trying to teach them about the pharmacological effects or basic information about how drugs work. That's important to know, but ultimately research shows that that by itself is not going to change behavior. We critically have to address these misperceptions. So that's the overall model, and I'll turn it back to Patty at this point.
All right. Thank you, Wes. So one of the things, and Megan, we can just stop the slides for just a moment now. Wes, thank you for providing that brief overview. As we think about the focus of today, which is really on how the broader community can share positive norms to support youth substance use prevention, whether in existing campaigns or on their own to achieve the same effect. I want us to all just get grounded and crystal clear on the why, right? You shared how the approach works and some of the evidence supporting the approach. But let's really kind of dive into the value of activating that social norms approach at the broader level. And as you know, and as Laura had mentioned earlier when we started this conversation, we've had a number of organizations really eager to apply this approach beyond a formal social norms intervention, who really believe in the power of the positive norms and wanted to promote it, saying, hey, what about putting out in newsletters or in group conversations and group sessions I have, or everyday conversations? We may not have a formal intervention in our community, but we'd really love to promote this. We see the value in that. And that left us wondering around and coming full circle to kind of how we got to where we are today, which is if we know positive norms can make a difference, why aren't we making it a priority to share them far and wide? Because it seems as we should be. So, Wes, as an expert in social norms theory, can you share with us your perspective on what you see as the value of really inspiring and mobilizing community members and organizations to start this work, to routinely make it common to share and celebrate the positive youth norms within their communities, in conversations with youth and throughout the environment?
Yeah, individuals, what we've noticed is often doing this work do not have the resources, they may not have the time, the money to take this on by themselves. And so consequently, engaging what we're calling assets in the community to help us with this at the very least, and they can, as you're suggesting, do some important and beneficial intervention work on their own. Believe that will lead to youth being more consistently exposed to the positive norms. It becomes the norm to share the norms, as we talk about, when sharing positive norms is part of the culture. So, and another point I want to make here is that the exposure to the message, our research has indicated that it is the most critical element in the intervention. I use the adage of we talk about what's the most important thing in real estate. It's location, location, location. Well, in social norms interventions, it's dosage, 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 getting the exposure out. You can't just hang up a poster once during the Awareness Week campaign and go home, because the forces that are producing those misperceptions that I went through, from mental processes all the way to all the cultural influences that make us misperceive the norm, are happening 24/7. So we need to engage assets beyond our own initiatives. And that's important. So various community initiatives can be taking place. And the importance of this is that it can create what I call a synergistic effect of hearing a message, because we can have a message coming through a formal campaign of some sort, media campaign, let's say, and I hear that, but I might say, I don't know if I believe that. Oh, that can't be true, and so forth. But if I hear someone that is in relationship to me in another capacity talking about it, I might begin to think about it. And if I see it in another type of signage or in another news report or in a newsletter, I begin to take it more seriously. First of all, I'm getting more exposure to the message, but also I'm hearing it from different constituencies, which may have greater or less credibility with me. But ultimately, I'm going to end up with more credibility in believing the message if I'm hearing it from various constituencies that I have varying degrees of trust in. So that's important. I would just say to start, we experienced this. I mentioned that I started off doing this work in my own college population, and we got some funds to launch a major media campaign, and we did this through the campus and so forth. But we began to learn if we wanted to keep it going and make we were cutting risk behaviors by we were focusing especially on alcohol misuse, cutting them by 20%, the high risk rate. But if we wanted to push that down more, and if we wanted to keep it going, we couldn't just do it on our own time and energy and funds. We needed to get others involved. So we would get people like the coaches we engaged the athletic department and brought the coaches in. We brought the team captains in and trained them and gave them the information about this phenomena so that they could act as ambassadors for this. We went to the health center and said, "Can you display this on campus? And can you display these messages?" And we went to faculty and began to talk to them about, hey, you might be able to talk about this in your course, in a variety of different kinds of courses that were ongoing on campus. So we had workshops for the faculty. Those are just three quick examples of building allies. And I think we're going to be talking about that much more in the secondary school circumstance for today. So maybe you want to say a few words, Patty, about how we begin to think about this and what the ADAPT team and the rest of us have been thinking about to engage this.
Thank you, Wes. You really drew out some really important considerations around that synergistic effect and really the value of bringing these positive norm messages into multiple settings and to the point where it becomes common discourse to kind of talk about and celebrate and promote in order to help not only with the celebration and promotion, but that exposure. You mentioned dosage, dosage, dosage. So really a lot of this is what led to our discussions, Wes, between Wes and the ADAPT team, putting together a way of thinking about community activation. We wanted to organize this in a way that we could share it with you and you would have some concrete understanding of what community action activation looks like within a social norms approach, and also some guidance on how to do this. Now, we have created a resource to help support you in this, a guide, and that guide is available to you all at our Prevention Intervention Resource Center. My colleague Summer will drop that in the chat here in a moment for you, so you all can all access that. We encourage you to download it, save it, print it, and after the conclusion of this webinar, take some time to really dive in and to review it. But we will do next. And Megan, if you wouldn't mind getting those slides back up again, I will go ahead and start walking you all through how we kind of put this all together, this community activation sort of process and way of thinking. All right. Slides. Mobilize. But first, let's start with the goal. When we're talking about community activation, what is the goal really? And the goal is to activate the social norms approach at the broader community level to bring those positive youth norms to life in conversations, in the environment, and through any other form of messaging available that could go out to youth and adults. And to be clear, what our North Star is, and the purpose of doing this is to support youth substance use prevention, because this exposure can in fact correct misperceptions of youth substance use, which will then ultimately shape that behavior. Okay. So when we think about community activation, what we did here is, and I'm going to walk you through a community activation diagram that we came and put together. We're starting to think about the best way to understand this, because we recognize that youth, all of us, but youth in particular, are influenced by many different things happening within their environment and people within their environment. And they're exposed to a number of different settings and individuals throughout the day. So if we want to think about how can we capitalize on opportunities for those youth to more frequently hear those positive norm messages at a frequency enough that's going to correct those misperceptions and lead to behavior change, right? What, how much, and how extensively do we need to mobilize the broader community? And we thought about this and we thought, well, there's really no limit within a community. Everybody within a community, whether you directly work with youth or you don't, has an opportunity for the most part to help support this. And we thought about how to mobilize, and we kind of broke down those into sort of two core functions or mechanisms. The first being something we call direct mechanisms, and the second being supportive mechanisms. And so what I'm going to do is kind of highlight and define what each of these are. When we think about direct mechanisms, really these are simply just the various methods by which positive norm messages can be shared. And again, that's going to be through conversations, the environment, and other media. And then there are the supportive mechanisms, which are all of those activities that make that activation possible. So what I'm going to do now is kind of dive into these direct and supportive in a little bit more detail. So as you can see here with these direct mechanisms, this is going to include a lot of individuals who interact with youth, parents, caregivers, teachers, healthcare providers, these could be coaches, spiritual leaders, mentors, and even youth peers who may be conversing with youth on a routine basis or have access to the environments within which youth live, homes, schools, recreation centers, places of worship. And so when you're thinking about these conversations and these environmental and other forms of messaging opportunities, they're really sort of endless in terms of the possibilities that, for exposing youth to those positive messages. Some of those are going to be very direct, dynamic messages like conversations. They're often going to lead to some type of a dialogue, or they can. And other times that message is going to be a little bit more static or one way. Things like flyers, billboards, or screens in a healthcare setting or a school, morning announcements or announcement at a school event, right? Those are going to be a little bit more sort of like one way. But both of those types of communication can be leveraged here within our direct mechanisms. And really, it's the direct sharing of youth norms is really, when you think about it, it's like, well, how do we help prepare people to do that? What is needed for all of these entities and these settings to effectively share those norms through these different mechanisms? Well, that's where we thought through what might encompass those supportive mechanisms. And the supportive mechanisms are really quite diverse, but there are various activities that are critically important to the successful dissemination of those positive norm messages. So this may include things like developing policies to support collecting and sharing positive norm messaging, the actual collection and analysis and sharing, and also making publicly available local data that does get collected, training community members on how to use the social norms approach effectively, what that theory means, and why is there value and importance to spreading those positive messages. Advocating for positive norm messaging across media and communication channels, right? And all other sorts of types of assistance. A number of community organizations can be involved in this supportive work. Some of the most common ones might be things like Community Coalition and other youth-serving organizations, school districts and school boards, health systems, local government agencies, law enforcement, local media outlets. What we do know is that by activating both the direct and supportive mechanisms in a community, that can really help to, oops, lost my little toggle there. That can really help to create a sense of shared ownership that's grounded in local knowledge and collective action amongst all of these entities, and really getting to normalizing and building a culture where the community routinely shares and celebrates the positive that exists within the youth that live there. So what I'd like to do now is transition into some very explicit examples of what direct and supportive mechanisms might look like. And then you have more in your guide, but Wes and I are going to share with you some of the common examples. Now, when we think about the direct messages, often, and especially when it's a direct messenger, often youth are going to be hearing this from some of the most trusted voices in their lives, who also have some of the most influence over the youth's life. Now, these might be a number of the roles that you see here on the screen: parents, caregivers, teachers, school staff, healthcare providers, extracurricular program leaders, other youth leaders, and even youth peers themselves. I think it's important to know that if we want to be successful at activating these messengers to share those positive norms, we have to understand that they may not actually, as Wes mentioned earlier, be aware that misperceptions of youth, substance use even exist. In fact, they may be in the misperception themselves, thinking that substance use in youth is actually much more common than it in fact is. And so this is where orienting and training these messengers is really going to be critical. Now, we have a number of conversation examples that I'm going to share in a moment, but I think it's important to keep in mind that if we're opening a dialogue to share this, we have to think about the perspective of the recipient. Like if I just came out to my child and said, "Hey, I saw the results of the school survey, 86% aren't using substances. Go middle school students," right? That I could say that, and it promotes the positive norm, but it's also an opportunity to take it a step further, to put it into context, to get curious, say, "Hey, what do you think the answer to that was? You know, why did you think that? What led you to believe that that would be the number? Well, this is the actual number. Why do you think there's a difference there, right? What do they understand about it? And not only why, or what that number is, that most youth aren't using substances, why? It's an opportunity to explore with them. Why do you think most kids aren't? And what are they doing instead? How are they protecting themselves from those situations or circumstances where they may be exposed or encouraged to use? Do they feel they have adequate resources to handle that type of a scenario should it come up, right? And so the goal then becomes to not only share the positive norm message, but to contextualize it in a way that is meaningful, that is relevant to that particular dynamic and relationship, and is authentic from the person who's sort of delivering it. So here are a few examples that we've extracted from our toolkit. The first is a teacher example. Now we've done, I always get really excited about this particular type of example. So that's why I'm starting with it. We've helped a number of schools implement a social norms media campaign within their school settings. And we often talk about how can you, beyond sort of the print media, how do you infuse this into the curricula within the school? And one of the sort of, I think, maybe easiest ways to think about it, because we're talking about numbers and percents and ratios, is within math or statistics. So this is an example that kind of showcases that, but it shows how a teacher might do that. And it's not just math or stats, or many other ways to kind of bring this into other sort of, coursework. But in this example, let's imagine a teacher says, "All right, class, we've been talking about how to read data and what it tells us. So here is a chart that shows some real data from our school. So you may recall last May, all of you students completed a youth survey. That survey asked about how often youth use substances like alcohol, tobacco, or marijuana in the past 30 days. What do you notice in this data, right? In this data chart, giving students an opportunity to observe the chart. Right, 86% said no. So let's think about that. If we have 400 students in this school, how many students said no? Let's calculate it. Give those kids a chance to do some math, and then you talk about it there further. So the vast majority, 344, that's the correct answer, aren't using substances. And then in this case, this teacher has an opportunity to carry that further. So does that match what you assume before seeing the data? Why or why not, right? Why do people sometimes think this is more common than it actually is? So this is just one example of how a school may, or a teacher within a school setting may deliver this in a conversation. As a setting, The school could also be doing other broader forms of messaging throughout the environment. Within a school system, since it's sort of a closed microsystem, a lot of times this includes things like print media, flyers, table tents, floor decals, announcements at school events before games, on display monitors, things like that. And so this is one example of a teacher really bringing to life the sharing of that positive norm in a meaningful way to them. So another example I want to bring up is and Wes mentioned athletics earlier. Oftentimes, folks who work in extracurricular programs as program leads, whether they be coaches or art or music directors, have an opportunity to also do this kind of work and put it into a context that makes sense for them. So here's an example of a high school basketball coach holding a team meeting at the start of the season, trying to set expectations to build culture, a solid team culture. Might say something along the lines of, I really want to talk to y'all about something that's actually part of what makes a great teammate and a great competitor. You know what sportsmanship really comes down to? It comes down to knowing who you are, not letting outside pressure turn you into someone you're not. And on the field, or in this case, the court, we call that mental toughness. I saw some data from our school recently. I was surprised. 76% of students haven't used alcohol or other substances. That means that the teammates sitting next to you right now, most of them are making healthy choices, and that is discipline. And that's the same muscle you use when you're down in that fourth quarter and don't want to give up, right? And then you have an opportunity to allow the students to respond, maybe connect the conversation to things they care about. Share a positive celebratory statement affirming the positive and healthy choices that most of the youth are making. For example, I am proud to coach a team where most of you are already making that choice. And if you find yourself in a situation that's tricky or that you might want to talk about, I am here for you, right? One more, because I think this is an important one, that even though youth might find themselves are often in the misperception, over time, youth can, and as they get exposed to the true positive norms within, their school, their community, and they start to believe those positive norms, they can also serve as positive norm messengers within the context of their peer group. So here's an example: group of friends hanging out, someone makes an offhand comment like, oh my gosh, everyone drinks at parties, all the kids at school are vaping. A peer who knows the data might actually be able to respond and like, well, you know what, that's what I thought too, until that survey we did at school. It was something like 86% who said that they don't drink or vape or use drugs. I was kind of surprised. Yeah. So here's one more example of how conversations with youth can be leveraged to share positive norms in authentic and meaningful and relatable ways for those contexts. Many more examples of these direct mechanisms are provided. We're showing you in there not only the conversation piece, which I'm highlighting now, because that's a little bit most nuanced, but also examples of how to leverage the environment and other forms of communication with whichever of these roles somebody might find themselves falling into. So let's pause the slide share there just for a moment, because Wes, I'd like to invite you in for a moment to this conversation. You've done a lot work with parents and others who we may not readily think of to activate for sharing and spreading the positive norms. So can you share maybe some examples or some successful ways that you have seen parents and maybe some others activated into sharing the positive norms?
Sure. Parents is an interesting one and a very important one, obviously, to consider here, um, because parents, first of all, misperceive the norms as badly as students do. That is, misperceive the norms of their children, their teens. If we're talking about like middle school and high school students, when they're asked what percentage do you think are doing this, or what do you think the norm is, they overestimate or believe the norm is the problem that of concern, and don't realize that there are so many students who mostly silently are not engaging in the behavior or taking the risks or hold the permissive attitudes. So it's important to get that message out, as we've suggested, to parents about what the norms are among their teens, the teen population, so that they are not carriers of the misperception, such as saying, well, I know all the other kids do this, but you're not going to do this. That's a hard sell. An easier sell is, listen, we've got the data in the community. Here's what you all say. And we hear that 82% don't do this. So it's not true that they're all doing that, and share it in a dialogue or conversation as you've suggested. So having parents in the know so that they can have dialogues with their own children is important. It's also important that they can challenge other parents who may be very permissive in their behavior with their children when they're doing things like letting the children have a party in their home and have access to alcohol or something when they think but parents don't say anything about it, remain silent, perhaps let their kids attend those kinds of circumstances because they think, well, I'm the only parent who feels this is a problem. So we're in many ways trying to free them out to be active bystanders, as well as we're trying to free up the responsible students, which are the majority, to act on their own personal beliefs and attitudes. So getting those parents activated in that way is important. It's also important in terms of rules we found in another way in the work with ADAPT and elsewhere in surveys. We've asked students, do your parents have rules? And overwhelmingly, they'll say yes, they have rules about alcohol use, tobacco use, vaping, all the different drugs that we might be concerned with, prescription use of prescription drugs that aren't prescribed to them, rules against that, and so forth. They'll say my parents do, and they're aware of that. But when asked, well, what do you think most other kids' parents' rules are? They'll think the other parents don't have rules. And so we come up with these circumstances where the teens are saying, well, all the other parents don't do this. So we need to get the rules out there, not only to the parents, so they can be more uh, uh, resistant or in their actions and enforce their rules, but we also need to get it out there to the students, getting the information about what the parents' rules are and getting it out to students so that they don't operate under the assumption that all the other parents are allowing their kids to do this. So it works in a myriad of ways, and there can be discussions at PTA meetings, in newsletters, and in the community in general, having signage and digital information about what parents think and what parents do and what do the majority do, so that those students who start to question, well, not all the other parents are doing this, will think twice about that in the future. So parents are an important one, but there are other people. We've talked about athletics and so forth. Camp counselors. I've worked on projects with camp counselors with the American Camping Association. But we've got all of these youth who leave school, and then what happens for the summer? They go into other settings. Well, those are settings in which we can also find out what the norms are of the camps that are going on in the local community and feed that information back to them. We, for example, did a project where we used summer camps where they were going 2 weeks or 4 weeks to summer camp and surveyed the campers, young campers coming in the door or coming into the camps, so to speak, about do they use tobacco or not, and so forth, and what's their attitude about it. And of course, overwhelmingly, they're not. And so we took that information and immediately fed it back to them in the dining halls, on placemats, and in areas around the camp, so that they could get the information there. So they're not losing sight of what the true norms are over the summer period before they come back to school. Um, There's also other kinds of circumstances, school resource officers and other police that are coming into the schools can act in terms of if they're equipped with what the true norms are, that they can start to emphasize what those peers, the norms are, and use that information to build allies in the kinds of communications they have with their peers. I mentioned that uh, um, we, in our college setting, began to use a different variety of assets to engage in getting the word out. We used our security officers in a similar fashion. For one thing, they would when they would go around to the dormitories and check the locks to make sure the doors were locked and so forth. They would put cards on the doors saying, "Thank you for keeping the doors locked. By the way, do you know that 92% of students lock the doors. 92% of students, 75% of the students don't engage in risky alcohol use." And they would actually serve as mechanisms to deliver the message for us and in casual conversations with students because they had lots of conversations with students. They weren't trying to shame them or threaten them, but say, by the way, here's what the most of the people you're living with want, and here's how they behave. So it's a similar kind of thing can take place in high school with security officers and in middle schools and so forth. The last thing I just might mention is something newly emerging. Um, Jessica Perkins at Vanderbilt University and colleagues at Massachusetts General Hospital are working with some community organizations to get barbers and barbershops in, especially in urban ethnic minority populations, to focus on risk behaviors and provide information and so forth. And one of the strategies here is to get the barbers informed about accurate information about what community norms are about healthy behaviors and the desire to avoid risk behaviors and so forth. So those are all wonderful new ways that I think that uh, we can come up with ideas and use the community individuals who are hubs in the communication process to help in the work of getting the message out. Those are just a few thoughts along the way.
Those are fantastic additional ideas, Wes. What I'd like to do, because we've talked pretty extensively around some of the direct mechanisms, is transition back to talking about some of those supportive mechanisms very briefly. And just in the sake of time, I will go through them pretty quickly because I want to make sure we have enough time to, Wes, come back to you to talk about how you might actually do this, um, and what is needed to do that. And we have a process to share for that. And so if we could get the slides back up, we'll go ahead and continue that. Thank you so much, Megan. All right. So regarding sort of these supportive mechanisms um, that help activate the actual sharing of the positive norms, we just wanted to give a couple of examples that are we have a number listed in the guide. Some of the ones I'm going to share here are some of that, like a first step oftentimes that may be easier to achieve step than some of the others, right? And so, for example, when you're thinking about systems, well, students often, are in a school setting. And so there's the direct school whose staff and environment can be leveraged for sharing norms. But then the broader school boards and districts can also play a role. They could play a role in supporting that. They could play a role in developing a formal policy that requires schools to actually collect youth risk behavior data every 2 years and ensure that there are measures that actually identify adequate number of positive attitudes and behaviors included in that survey. Healthcare settings is another system that oftentimes is already in the process of collecting, patient-related data, sometimes through a validated screening tool related to substance risk and otherwise informally. But the systems themselves could really sort of develop a policy requiring use of a validated screening tool. And then maybe they could support their affiliated practices by collecting and aggregating and reporting back that data in the form of positive norm messages and templates that can be used or flyers in the waiting room or digital screens in the office, things like that. Local state media. This is where, advocating to help support and influence local and state media to present more accurate representations of youth norms and really to seek out and feature the stories that highlight those positive youth choices. Within the context of government, again, policy is an opportunity around public sharing of youth behavior data and publicizing that, or even helping support the systems create dashboards for how that data can be accessed and used. Even local law enforcement, many law enforcement officers have intersections directly with youth. And so training in the social norms theory and then in how to incorporate those positive norm messages for those high contact officers, or those officers have high contact with youth, such as school resource officers and community police officers and others involved in various outreach initiatives or school or youth athletic leagues, for example, can really be prepared to how to share those positive norms with youth when they engage with them. But then they can also promote the positive messaging in different ways in different environments that they have, such as, as content or poster, not posters, but like I was saying, those stickers, like, on police vehicles, for example, that really kind of celebrate the positive youth norms. And so at this point, I've spent an extensive amount of time kind of trying to dive into a little bit of what we mean by these direct and supportive mechanisms. We hope that you all can find yourself in within those. We know that you can. We know that either a direct role with youth and or through one of those supportive mechanisms that you may be able to see yourself. And so now we're going to transition over to Wes, who's going to talk a little bit about how then do you carry that forward? What are some of your first steps? Recognizing that not everybody on this call is going to fit all of those steps. Some of you may, and others may end up, a few are going to be the ones where you kind of sit and reside. And I think that'll make more sense as Wes carries that forward. Wes, over to you.
Okay. So, first of all, let me just put another shout out or plug in for this guide that's been developed. I'm really excited about it with all the anecdotal examples and information that you can take advantage of. So make sure that you do get a hold of that and read through that. But for the moment, what I'm going to talk about is what's the process of getting to messaging and sharing and so forth in a social norms intervention. Well, the very first step is that you need, it's based on data. It's based on telling the truth about what youth norms are. And so inherently one has to have data, credible data that from which one can generate messages about the positive norms. That means we either have to collect the data or get access to it. Now, not all of us are researchers, or not all of us are methodologists or surveyors and those kinds of things. But oftentimes there already is data that's accessible that's been collected in a local community or in a county or in a school district that one can take advantage of. So it's gathering the data is the first step, and I'm not going to go into details about the survey work here. We don't have the time, and that's for another day in another session. But once we have the data, then we have to analyze it and review the data to identify the true positive norms and look for types of questions that have been asked in a survey, for example, that can be used to identify the norms, or if there's other kinds of data and records that are kept in the local community, we can provide those indicating the majority doing the right thing, not and so forth. So we've got to analyze the data and then create messages out of that, and then ultimately share that out, reinforce it, and evaluate the impact and repeat it again and again. But what I want to concentrate on for the moment is the actual moving from getting the data to coming up with the messages, because that's what people often will say. Well, I'm not sure in my community because they have misperceptions too that we can do this because we know that in our community or in our school we have a relatively high problem rate with regard to substance use, let's say. And so consequently, we're not sure we can come up with messages from the even from data that we've collected. And here, I want to what we're talking about is telling it like it really is, taking the data, and in that data, let's see if I can get this, aims to correct the misperceived norms and strengthen the accurate perceptions to in turn prevent and reduce risk behavior. Now, what we're doing then is focusing on making healthy, positive, and protective actual norms more salient and visible. So, given that, how are we going to do that? We're going to, in essence, what we call flip the message or flip the conversation. Rather than talking about the problem rates, talking about the positive rates and going at the data in a different way than is usually reported in the news or an analysis that wants to demonstrate the problem to gain funding to address the problem. So here, I want to give you an example really quickly. I was asked to do a webinar for a conference in Delaware County, and I was talking with prevention professionals within Delaware County. This is Delaware County, Pennsylvania. And this was in 29. They had data collected in their Pennsylvania Youth Survey where the data was broken down by county. And they had 12,490 students from 6th, 8th, 10th, and 12th grades in the county had participated in the survey. And so they had a lot of data from the county, but they immediately said, we've looked at the data and we know that in our county we have higher rates than in other counties in the state, and so we're not sure that we can come up with positive messages from the data in this survey. So I said, well, send it to me and let me see what I can do in terms of messages. And I looked at the data, and this is what I came up with in less than 30 minutes based on the report that they had in their hands already. But all I had to do was just flip the data, flip to what was the positive amount or the positive percentage instead of the negative percentage of risk. So when asked about the last 30 days, um, 4 out of 5 10th graders in Delaware County, that was 79%, had not consumed any alcohol. I'm going to run through a number of these that I just created in a matter of minutes. Most 12th grade students in Delaware County, 64%, had not consumed any alcohol. 95% of the 6th, 8th, 10th, and 12th grade students in Delaware County had not smoked cigarettes. The majority of 6th graders, 8th graders, 10th graders, and 12th graders in Delaware County had not used marijuana. Let's keep going here. When asked about the last 30 days, more than 98% of all 6th, 8th, 10th, and 12th grade students in Delaware County had not used inhalants. 4 out of 5 10th graders in Delaware County had not used cigarettes or vaping. 7 out of 10 12th graders in Delaware County had not used cigarettes and vaping. 99% of 10th grade students and 98% of 12th grade students in Delaware County had never used cocaine in their lifetime. 97% of 12th grade students in Delaware County did not drink alcohol and drive in the last year. More than 80% of all 8th, 10th, and 12th grade students in that county agree that people are at risk of harming themselves if they use prescription drugs that are not prescribed to them. And among 6th, 8th, and 10th, and 12th grade students in Delaware County, 4 out of 5 believe it is wrong for someone their age to use prescription drugs that are not prescribed to them. Simply in a matter of minutes, these are all messages of strong, positive, healthy majorities that I could pull from the data just by reading the reports, which had been reported in terms of what percentage were exhibiting a problem and just flipping the data. And so all of these messages could be delivered through any of these sources that we've talked about in a social norms campaign. Here's some examples traditionally we've seen in other social campaigns where the message is flipped and often images are put with it showing healthy and positive individuals, not the negative consequences of, of the problem we're trying to reduce. So as you see here, this was from a project that was done some time ago in DeKalb County. Together, 83% choose not to smoke. Um, let's see if we can get this. There we go. A project in counties in Montana making the point that most of the teens were tobacco free, even though tobacco use in Montana at the time among teens was quite high. 70% were not using, and that's the kind of message that was done. And dogs sell in media messages, so we put the dog in to provide the message that most teens, 70%, were tobacco free. Here's one from Summit, Colorado, where the message on the left was saying, "Don't tell me not to do something I'm already not doing," using the youthful edginess about adults to make the point that the majority were not doing it, and so forth. Let's look at some others. You told us Colorado Central students had not, most of them had not consumed alcohol in a typical month. And here's a couple posters from the ADAPT project with middle schools that was done most recently in 2023 and 2024. Using the examples here, do not use marijuana or cannabis products. I do not use it. And the fact that over 90% were saying this. 90% of students in Fairview Middle School choose not to use alcohol, tobacco, or other drugs. So you get the idea. And here's one last digital signage that appeared in one of the schools. Check out this statistic based on your survey results. The social norms approach is best done when it's just reporting back to the students, not finger wagging, not telling them what they should be doing, but saying, here's what you've told us about yourselves. Here are your norms. And here's what it said. Most Washington middle school students, 89%, never smoke or vape marijuana or eat it in treats. So those are the kinds of messages and what we mean by flipping the message. Um, and so lastly, in this process of collecting the data, analyzing it, flipping the message, getting the message out, getting it out to a variety of um, through a variety of complementary assets that may be able to deliver the message. We can also see that what is it that makes the social norms approach most effective? First of all, you need clear positive norm messages. Secondly, it has to be based on credible data. The absence of in the absence of competing scare messages that tend to exacerbate the misperceptions. The dosage has to be high, as we've said, ongoing and intense social marketing of the actual true norms. The synergistic strategies engaging community assets to promote the positive norms is also a critical element and is really the thrust of this webinar today, that in contributing to the success of social norms interventions. And ultimately, we need to reach the broad population to receive the message in addition to any high-risk target groups. Because when the broad population receives the message and internalizes it, and most of them already in their personal behavior and attitudes are exhibiting what the message is all about, they can be more forcefully and confidently engaged in the conversation with others and not be a carrier of the misperception anymore. So that's why that's also so important. When we do all of these things listed there, that's when we have the best success. We get dramatic results in reductions in risk behaviors. Indeed, that happened with us in this latest project with middle schools that I mentioned that ADAPT was running. We got reductions in use rates and permissive attitudes. 20% reductions in the risk rates, up to 50% reductions in the risk rates in some instances on some measures. So if we can do all of these things, and certainly those synergistic strategies, engaging community assets is a part of that, that's when we're likely to have the best success and the strongest effect. So I think I've used up my time here, and I want to pass it back to Patty at this point for any concluding remarks and Q&A. If we hopefully we'll have a little time for that.
Thank you, Wes. And before we head into Q&A, I do just kind of want to highlight one of the roles, and this role is one that represents probably the overwhelming majority of those who are here on this call today, Wes, and that is the prevention workforce. And I think one of the things that's really important to keep in mind, as those of you who do represent the prevention workforce, is that you all have a unique opportunity to support not only your direct conversations and the direct environments that you have influence over with youth, but also to truly help serve as a lead to help activate those various supportive mechanisms as well as a number of those direct mechanisms as well. And so this could look a lot like things such as helping train people and orient them to social norms theory and the approach, helping create messaging guides where community members can receive those positive norm messages and some talking points or ideas or templates on how to contextualize them within your local community, really kind of working to help support the advocacy elements within the local government and school districts and boards to help support the data collection process and the public sharing of that data and so on. Many more examples are in your toolkit or your guide rather. And so I'll point you to that because in the sake of time, we do want to honor the Q&A. There have been a number of questions coming up. We want to make sure we have time to adequately address those. And so I think that's it for us now. Laura, we're going to hand it over to you to facilitate us through the questions that have been coming in.
Great. Thanks, Patty. So you all should have access to your toolkit. Now you'll see the picture now, and then you'll see the link to it. It's with the word here, all in capital letters. You do have to click on that word to access the toolkit, but it is available to you. Wes and Patty. So a couple of questions that we consistently get. These aren't new. It's a question that we consistently get anytime we offer a training on social norms. We have individuals and organizations trying to share these wonderful things that are coming out of the survey, and they're met with resistance from the youth in receiving them. The youth are saying, "Are you lying? We don't believe this. This can't possibly be true." Can you offer some ways of responding to youth after they've said something like that and suggested that you're lying with this source of data and the types of data that you're sharing?
Yeah, that's one of the most common responses in every workshop I do. It is so common that I have just a few slides set up for that, anticipating that if we can get those put up, I'm happy to do that. Um, do we have those available?
Yeah. Megan, do you mind sharing those real quick for Wes?
There we go. So let's see if I push this onward. Well, I guess there we go. So basically, like I said, it's a few slides that I put together about this. The common questions about reliability of survey results. Well, what are they? And I think this will ring true for probably most of you about what these questions are. Do people really remember accurately? I think it's worse than you're telling me it is because people don't remember all the things they do. Or are people really afraid to be truthful? Or do people just intentionally lie because they want to lie? They want to hide the truth about their bad behavior and so forth. Well, let's see how I would respond to this. First of all, do people remember accurately? Well, there is individual error in surveys. I don't always remember every time I might have engaged in a particular behavior and the exact number of times and so forth. But people overestimate sometimes and they underestimate sometimes. And those tend to cancel each other out so that the overall average that we find to be the norm is still an accurate norm when it's measured. Also, if we talk about attitudinal norms, that is, what you think is right. And we know that most young teens and all say, I don't think that we should engage in this behavior. That's my attitude. I don't think we should risk our health and so forth. And that those aren't subject to recall error. It's not that I can't remember how many times I did it or not, unless I have instant amnesia. This is my attitude, and this is what I think when I reported on the survey. And so that's not subject to error, and yet that also shows the overwhelming majority have positive attitudes. You can we've seen in studies with anonymous BAC testing, that is, it doesn't actually show the result on breathalyzer tests, but it confirms that young people do not underreport their own drinking levels in various at parties, proms, coming home late night on college campuses, a variety of places this has been done, and demonstrating that the majority are, depending upon the setting, are either sober or abstinent completely. And again, so we have biological information that reinforces what the true norm is. Are people afraid to be fully truthful? Well, we're basing our messages on anonymous surveys, and that's important, first of all. Secondly, the same pattern of misperception we find in legal age populations regarding, for example, drinking, where people are reporting not with the threat of reporting some illegal activity, and there's still less alcohol consumption. The majority drink responsibly or don't drink at all, and so forth in these populations. It's also found in with anonymous surveys about tobacco use in youth, where there's little fear of penalty. And also we find it same pattern of misperception with anonymous surveys about seatbelt use, except the more use seatbelts than is perceived to be the case because that's a protective behavior. And that has been found in in reports. So if there's very little penalty for it, and yet they're still reporting much less positive behavior, it's got to be something other than fear in taking a survey. And thirdly, do people just intentionally lie on these surveys? Well, reliability and validity tests of surveys based on patterns of responses by individuals show only about 1 to 3% intentionally are providing erroneous answers. That's not going to change what is the majority position, what is the dominant norm, even if all the 3% are saying something extremely or in one direction opposite of what the truth is. Um, you can experiment with a group that took the survey and ask if anonymously if they personally lied, and very few say yes. I do this frequently in presentations and workshops with students where someone will say, oh yeah, well, we all lie on those surveys. And I say, well, that's interesting. Well, maybe I'll clear the room of the teachers and the principals and the anybody else. And I'm saying, you don't know me. I don't know any of you in this room. I'm from another state and so forth. How many of you did lie on it? And out of a whole room of maybe 100 or 200 students, three or four or five will raise their hands. And it's often not the people who say we all lie. And you can even do it as a clearer experiment in having people with clickers or or with clickers or with blank pieces of paper, write on it just a yes or no if they lied on the survey, if they remember taking the survey in the school year, and have somebody read off all the answers. And it's no, 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 yes, no, 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 yes. And they begin to realize that what's happening here is that the same that most of them aren't lying, but they thought it was. And also, you can make the point that the same results and patterns are typically found in multiple surveys of the same school population over time. How would that be the case if students were lying. It would take an unbelievable conspiracy of liars to get all the patterns exactly the same each time. So when you raise all these points that I've just done, students begin to realize that, and others and adults too, that this notion that everybody's lying on the surveys doesn't really hold water. And finally, why do so many misperceive others as lying? That is just another occasion to talk about why we misperceive norms. When somebody says they were lying, we tend to think more lying than is the case. So that phenomenon, that pushback, is actually a good example of what's going on with regard to misperceiving norms for youth and adults as well, in general. So those are all the different things, points that we can make to address that kind of notion that can we really trust the surveys and is everybody lying?
Thank you, Wes. All right, we have some really juicy questions that are important to get to. So I'm going to ask that we do lightning rounds with you. You think we can do this? 5 minutes. I'm going to shower you with questions. All right, the first is, can you speak to, we've had a couple people asked about this, how we're excited to share these norms. They're positive, we want to celebrate them, but we also want to do it in a way that doesn't stigmatize those who may be using in some way, shape, or form. Talk through how we should think about that quickly.
Yeah, and I can start, because this is one of the reasons why in formal interventions like social media campaigns, oftentimes you do message testing with the youth. How is this message sitting? And they have given the feedback that will say, well, we don't know if this is really inclusive messaging or not. We would say it this way. And so I think some of the ways that we have found that youth have reported that they will resonate well with that message is when it is celebratory, it does share that the majority are, but maybe it has a byline of, and for those who may, we care about you. These are ways that you can get resources if you want to make a change or to support you in what you're, going through. So it kind of takes that message that we're celebrating the majority and we care about everybody. Wes, would you add anything to that?
Yeah, I think in this instance, we got to think about it, reframe that question for the people who are concerned about somehow stigmatizing the students. For one, the point that the social norms makes is you don't have to put a judgment on the screen. We're just telling you what percentage do the positive behavior. Um, and thinking about it another way, what if we said that 15% are using a particular drug, which is usually the case in announcements, in news, in scare tactics, and so forth. Well, isn't that making the target the group isn't that stigmatizing them? So which way do you want it? Do you want to talk about the problem group and stigmatize them, or simply talk about what percentage are doing the positive thing in a neutral, newsworthy way? I mean, you can't get around the fact that you're talking about something that some people do that is a problem. But do we want to emphasize the problem or do we want to emphasize the healthy majority? And again, not saying, not finger wagging at those who are engaging the behavior, but at least not letting them continue or anybody else continue to carry the misperception that they're part of the majority, and so they're going to feel stronger and brag about it.
Thank you, Wes.
Mhm.
So, through these supportive mechanisms, we are trying to diffuse, and many of the coalitions and prevention workforce may be sharing then the data. They may be feeling a responsibility to share this data forward and to train and activate different roles in their community. What if they're met with resistance from certain roles, whether it's a coach or law enforcement or a teacher or a parent? Like, how should they address managing any type of maybe uh, not affiliating it with their identity or part of their role with that youth? How should they manage that conversation as they try to activate the community?
Patty, you want to take that or you?
Wes, I'll let you start and then I'll see what I have to add. Go ahead.
Okay. Um, if I understand this correctly, there's some who might be sensitive. Oh, I don't want to share the data. Let's say if it's data that says 78% of students are not drinking in the last 30 days or something like that. Maybe it's about a high school population. And they say, I don't want to, because that means that 22% are. They flip the data back. And if
Yeah, I
that,
think I think the nature of the question, sorry to interrupt, is just so we can get to the
okay.
response, is they're wondering when they try to train or activate the different roles in the community, if one or more of the roles just don't see themselves as it being appropriate for them to share any of these positive norms. They're not seeing themselves as responsible for that or wanting to engage in it in any way. How might you advise those coalitions or other prevention organizations to respond to that?
Well, I personally come about this from the question of, well, because they're at the moment, at present, they're presenting the information about the 22% that are doing it. So, what is it that you think you're accomplishing by talking about that? And if they can provide evidence that shows it's reducing the problem, if they provide evidence that it moves more people to not engage in it by telling them what percentage are doing it, because that's what they're doing if they're providing messages and it's not social norms messages, or they're just providing information about pharmacological information about what the effect of the drug is. And if they can provide information about this is really working, then just keep doing it. But of course, I'm not suggesting that because we don't have evidence out there that those things work. It's quite the opposite. And so, consequently, I'm saying look at something that's working and doing positive. Why wouldn't you want to be involved in that?
And I will just add to that very briefly is Wes, kind of that's where I would start too, is getting curious. What is it that doesn't feel appropriate for their particular role? If social norms interventions happening in a school, why would a particular teacher not want to get on board with promoting that message, right? And so, how much of that might be a lack of awareness or understanding as to what the ask is or what the value might be, but really want to draw out what seems to be in the way because it can be a reframe of we're not asking you to do more, but how might you leverage your conversations differently and infuse this where it makes sense. And not everybody's going to be on board all of a sudden. You may have some people who are very adherent to the status quo and they don't want to change things, and they tend to be the latter to kind of transition into new ways of thinking and doing. And that's okay too. As others around them start to move and shift, hopefully that will help bring them along in time.
All right. Unfortunately, we are at time right now. And for those of you that submitted a question, if you're anonymous, I'm sorry, I don't know how to. I would ask you to please send that question to the adapt email that I put into the chat box, and we will get you an answer. We will definitely get you an answer. So, for anyone else who has additional questions related to today's content, please submit an email to the adapt email, and we're happy to respond to that. Next steps include go ahead and download that toolkit. Start familiarizing yourself with the content in that toolkit. We've broken it up into two very clear sections, the direct mechanisms and the supportive mechanism. So if you have any additional questions related to that, I do just want to orient you quickly. There are 3 scenarios for every role. We really tried to bring it to life in and illuminate kind of how some common things, common scenarios in your life as you walk in your daily life through with youth. So if there are additional questions that come up with you, or if you would like individual technical assistance in any way, please reach out. We also have access to a variety of different resources that we've made available to you on that Prevention Intervention Resource Center, the same place that you found the tool for today. All right, stay on. You're going to, close out. Once you close out, the evaluation will pop up for you. We really would value your feedback on today's session. And we also will be sending you the evaluation link in the follow-up email, along with a link to the toolkit and a link, or actually, I think we're going to include Wes's slides because many of you have asked for those. Thanks for joining us today. Great to see you, and we hope that you have found today's content of benefit. Talk to you soon.